Welcome back, everyone, to Open Line. Glad you're with us tonight. We are talking with Dr. David Aronoff with Vanderbilt University Medical Center. He's Director of Infectious Diseases at Vanderbilt. We're talking about vaccines and a good first segment. We are also streaming this show on our Facebook page on NewsChannel 5. I'm looking at some of the comments, and we are seeing comments that I want to ask you about, Doctor. People are saying they're concerned the vaccine is being rushed, and they're reluctant to take it. So if we're seeing that from people in more than one case here on Facebook, what do you say there?
Yeah, I think it is important for people to know that there has definitely been widespread investment in helping us move from phase 1 to phase 2 to phase 3 and get these vaccines properly scientifically tested appropriately in the ways that any other routine vaccine would be developed. We've been able to accelerate that process not by skipping steps or shortening these studies, but by essentially being able to look at data and move from phase to phase quickly, because we're not having to wait the usual amount of time to raise money to do these studies or to identify who might be interested in doing a multi-center study, because right now the world is investing widely in trying to develop safe and effective vaccines, and there are lots of people who are interested in and experienced in doing these kinds of studies. And so that's allowed us to get to the point where there are now almost 10 phase 3, these are the large clinical studies that essentially compare a vaccine to a placebo and look to see two things. Number one, is it safe? And number two, is it effective? We really are going to see a vaccine candidate emerge that is both safe and effective. And I have definitely confidence in our public health groups and our investigators to do that. And I think that I haven't seen any evidence of cutting corners, and so I'm feeling good about where things are headed. The thing that we don't know is, will these vaccines really show protection? And that's what we need to see before we give a thumbs up to a vaccine, is that not only is it safe, it isn't causing side effects, but that it really is protective. And we may have to wait a bit. And that's why I think it may be more likely that we see a widespread vaccine being available in 2021 as opposed to 2020.
Okay, interesting. Now, there's been use of emergency use authorization. This is by the U.S. Food and Drug Administration. It's power to grant temporary accelerated approval to a medical drug or device needed in a public health emergency. So is that being used here? And I think some of the things that it's been used a few times, I understand, on some things that have been somewhat controversial. Will it be used here? And again, I guess calm people's concerns that that's the appropriate thing to have used here, an emergency use authorization by the FDA.
Right. So I think we have you said it very nicely. Emergency use authorization is essentially approving something to be used under emergency circumstances, rather than waiting for the usual process to lead to approval and, for example, completion of trials. I've been outspoken to say that I think we need to avoid an EUA for a vaccine. I think particularly because the public is concerned that we make sure that an immunization that we want to use in people who are not sick is safe and effective. And I think that's the best way forward, is to wait and look at the data, make sure that the vaccine is both safe and effective, and then release it for use. Now, if there's really a very high-risk group of frontline healthcare workers and a vaccine during a study is looking incredibly safe and incredibly effective, I could see an EUA being released, but my own thoughts is I would prefer to wait until trials are completed and not rush through the EUA mechanism to get a vaccine out. Because right now we're doing a lot of the things we need to do to prevent infection. It's things people don't like necessarily doing. We don't like keeping our distance from others. We don't like staying at home. We don't like wearing cloth face coverings in public. We want to be able to stop doing so much of that, which is, I think, why we're so eager to get vaccines available. But we're doing a good job of limiting the transmission of this infection. And I think that is buying us valuable time to let these trials complete and then approve the right vaccine for the indication.
So you said you've been outspoken in not wanting an emergency use authorization for a vaccine. Is it possible that they would do that? Would the FDA do that? Would they use an emergency use authorization, which you would not? I guess that's not what you want, but could they do that for a vaccine?
They could. You know, if in their opinion it's of enough societal benefit that the benefits weigh out the potential risks, they could do an EUA like has been done for some of the diagnostic tests that we've used or some of the medications or other treatments that we've used. You know, nobody in the federal government's asked my opinion of this, so you know, it's just my opinion, but I would rather see a properly concluded phase 3 clinical study that leads to approval of a vaccine and not using an EUA. We've seen from the great questions that you've already gotten that people are nervous about the safety and effectiveness of a vaccine, and all the vaccine in the world doesn't help if we can't immunize people with it. And the way that we can immunize people with it is to make sure that people trust that we're using something that's safe and effective. And so I think the EUA vehicle doesn't garner that sort of public trust that's important. So that's my own take on it. But some opinions differ. That's
interesting. And yeah, you could have a short-term victory and maybe not as much of a long-term victory. You're looking for the long-term victory here. Let's go to Ezra.
That's exactly right.
Let's go to Ezra here on line 1. Hello, Ezra.
Hi, how you doing?
Doing well. What's on your mind?
Well, I've been really thinking about this, and I was wondering whatever happened to the vaccine that Russia said they had. And to continue my thought, it's a shame that the Chinese even have to hack in or be punished for trying to hack into our information. It seems to me it's a global pandemic, and if there's an international collaboration for the space station, why can't there be international collaboration between all the scientists in the world for this vaccine to combat a global pandemic? And wouldn't that be the best way forward?
Okay. Thank you for that call. I'm interested. Yeah, she's asking about the vaccine that we heard about in Russia that received a great deal of, it was in the news, but there's also a great deal of skepticism. I'll ask first about that, and then I like her question about, is the world working together, or are countries kind of doing this on their own? China, Russia, the United States, is there some proprietary thing here?
Yeah, Ezra, thank you so much for that question. That's really important, and it's on a lot of people's minds. Again, getting back to the issue of, we want to use a vaccine in people who are not sick with COVID-19 and protect them. And we want to make sure that that vaccine has that combination of being safe and effective. And so we've heard of immunizations being used in Russia and China, but we haven't really had access to the data to know how are these exactly studied, what's the safety data, can we get fully transparent, open vetting of that information through our Federal Drug Administration and with scientists here. And without that level of comfort, it's unlikely that those kind of candidates are going to be deployed here and may not be shared anyways by those home countries. But I do think that this is clearly a global problem, and the more countries that can cooperate to bring a vaccine to the world, the better. I think this is not the time for nationalism, because this virus doesn't ignore county, state, or country borders. It's really crushing the globe right now. And so I'm hopeful that the lead vaccine candidates will be able to be used in the most vulnerable populations, not only in the United States, but everywhere. The World Health Organization has certainly been very active in trying to get countries to collaborate and cooperate around developing a vaccine. And a lot of these big companies are working in global studies. But your point is really spot on, that the best way to solve this global problem is with global cooperation. Do you have a sense of how it's going in Russia? Because that did get a lot of attention when Russia announced
Yeah, we have a vaccine. And there was, again, a lot of skepticism. But is there a sense that that is working, it's being widely distributed, or that that's not the case?
Yeah, honestly, I don't know. We don't get a lot of reporting from Russia, and a lot of what we learn in the United States is based on reporting, and it's or publications in scientific journals that have been peer-reviewed, and we just haven't seen that coming out of Russia. At least I haven't at this point. So I can't comment beyond saying I wish I knew more than I do.
And also to that point, and I bet the answer is the same, but is there any sense that China has something that they're deploying and is working? And I think the answer is you don't know, but I haven't heard as much coming out of China as far as, the disease. That was certainly where it started, but is it, is it possible they have a vaccine and it's working there? Are there reports like that? What do you know about that?
I think their reports are that they have a vaccine that's effective and they're using it. I don't know that we've seen those data and really feel comfortable being able to think about using that vaccine in our country. But I don't know a lot more than that. And so, I can't comment too much on what's going on there. But that's one of the difficulties with living in a world that has a global problem, but not globally open lines of communication.
Yeah, that's unfortunate. All right, another concern we're seeing on Facebook is we're of course going into flu season. And you've heard the term twindemic. You've heard the CDC say this could be a very dark fall and winter. What is your assessment? How concerned are you about what we are going into with the flu season and as the weather gets colder?
Well, I think nobody wants a bad twindemic or a collision course between what we know can annually be a bad problem, influenza, and what is now a new problem in COVID-19. There is reason to, I think, be optimistic here about this cold and flu season. Number one, it appears in areas of the world that are in the southern hemisphere where their winter is our summer and our summer is their winter, and they've already gone into flu season, that there was less of a burden of influenza in the southern hemisphere in countries like Australia, for example, and in South America than there was the year before. And speculation is that has a lot to do with all of the risk reduction activities around COVID-19, keeping distance, wearing masks, keeping our hands clean, surface disinfecting, because all of these are respiratory viruses, the colds, influenza, and COVID-19. And so doing things to block one of them should have beneficial effects in the other. And then, of course, we also have immunizations against influenza. So if people can make sure that they get their flu shot, if people can continue to do the things that we need to do to slow the spread of COVID-19, I think that we have a chance of seeing actually a reduced cold and flu season. We probably should have been paying closer attention to hand hygiene before, because probably people were sneezing on their hands, shaking people's hands, and transmitting virus that way. Those days hopefully are behind us. And so I'm going to be somewhat optimistic, but it's going to be tricky when somebody develops a fever and a cough to know, is this influenza or is this COVID-19? And so I think we're going to have to be doing a lot of testing for both. We may end up giving people medication for influenza when they actually don't have influenza unless they get tested. So it could get confusing. And that's another reason why if someone is symptomatic with shortness of breath, cough, fever, any of those warning signs for COVID-19 or the flu, this is the year to stay home and get tested and not go to school, not go to work, and not do the usual thing of, I'm going to take a couple ibuprofen, I'm going to see if I can rally and then get back into my job or get the children back at school. This would be the year to not do that and to say, we've all been making huge sacrifices, and this is another one that we need to make, is not sort of trying to fake our way back into reality.
I like that assessment that maybe all of these precautions will dampen the impact of the flu, and we'll be better off as a result. I mean, that is a positive assessment. So, all right, that's good. All right, we're going to take a break. If you want to call in, there's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.